Welcome to the Pelvis Party, a health talk show in partnership with Olmsted Medical Center, where experts and guests dive into real conversations about hormones, sexual and pelvic health, and everything in between. We're creating a space for honest, judgment-free talk. There are no dumb questions, no awkward topics, and definitely no shame.
Hi, everybody. Welcome back to the Pelvis Party. I'm Becky Montetit. I own RochesterLocal.com. This is my friend Britt Marshall. She's with Olmsted Medical Center Marketing. And this is my other friend, Dr. Melissa Richards. She is the chair of obstetrics and gynecology at Olmsted Medical Center. But I think it's important to say, in our work together, we have become friends. And we have really bonded over talking about women's health and our pelvises, right?
Yeah,
and all the
absolutely.
things and it helps that you're the expert and you've got so much to say and you're very excited about it.
So excited.
Here's the Pelvis Party. We have talked about urinary incontinence. We have talked about prolapse. We have talked about IUDs. And today, we're in for a doozy. Drum roll. We're going to talk about we're going to talk about discharge and smell.
Yes.
We're going to talk about discharge and smell because in this Pelvis Party, we are talking about the things that we want women to feel comfortable talking about.
Absolutely.
These are things that happen to us.
Yep.
Our vaginas do physiologic discharge.
Absolutely.
They have smells because there's warmth and bacteria and all these sorts of things. So we're just going to talk about it. So I think that's like something that we don't really like to talk about.
We don't like talking about it, no. Or if we do, we assume something horrible is going on, or there's a shame. We've talked about this a little bit, like shame, discharge, shame.
Well, and we don't want to smell,
No.
right? Everybody is a little nervous, like, ooh boy, you know, you don't want to smell, you don't want to be like, what do we call this? Swamp crotch. Have we all heard about this term?
So I learned that term from Becky, not previously familiar with it at all.
Well,
0%.
And I mean, it does sound a little crude. It does sound a little crude.
Skosh, yeah.
A skosh crude. And I don't use it in my normal everyday vernacular, but we don't want to smell this way. We want to smell lovely and feel fresh and feel clean. However,
We used the term when I was in the military, after days of not showering when we're out on doing whatever exercise, swamp butt. So like the very stinky, but that's like days of not showering. So swamp crotch is also new to me, but
and even, I mean,
It's not a swamp, everyone.
Swamp butt doesn't sound as crude. Anyways, we need to talk about this. We need to talk about this. We need
Absolutely.
to normalize this. So take it away, Dr. Richards. Talk to us about discharge.
Right. It's a doozy. So I think like normal versus abnormal, we talk a lot about this, and so there are certain types of discharge that warrant like treatment because we have something not normal going on.
Yeah.
Okay. So, and to be honest, those to me are like the easiest things to manage. A patient comes in and she's like, there's a lot of discharge. That is a change for me. That's usually a symptom. And then there's something else with it, like a change in smell.
Yeah.
And then also like itching or burning usually goes along with it. And so when you come in, we ask you all these questions, like any changes in like everything.
Yeah.
Just we tailor it to whatever, you know, oh, actually this is happening, or like I'm pregnant. Like there are certain things that make you more likely to get like some sort of vaginosis or vaginitis.
Okay.
So that's usually we're talking about bacterial vaginosis, which is an overgrowth of a type of bacteria in your vagina, or yeast, like a yeast infection. So super common.
Right.
So BV or yeast candidiasis, it's a fancy word for that.
What is it?
Candidiasis.
Candidiasis.
I think I'm pronouncing it correctly.
Okay,
Now
yeah.
I feel like on the spot.
No one's
It's
going to check.
probably right. And then, so we can actually do a test for that, a swab in the vagina, and then tell, based on what we see based on your symptoms and based on your exam and based on the swab, it's called a wet prep, we can diagnose you. If you have bacterial vaginosis, you get treated with an antibiotic. If you are diagnosed with a yeast infection, you can actually treat over the counter with a vaginal cream, or there's an oral medication you can take. Same with actually the bacterial vaginosis. You can take an oral medication or you can in your vagina. Usually they're exclusive. Sometimes they'll like come together, which is kind of interesting because they both require different environments to overgrow, but can certain like medical conditions like patients with diabetes are more likely to get yeast infections. So like those we need to treat, right? Like those are actual infections. You want to make sure. Trichomonas is another, that's a sexually transmitted infection that also gets tested as part of that wet prep. Other things that we can see in that wet prep, just white blood cells. So yeah, it's interesting, right?
So we've got normal and not normal.
Totally.
Discharge. And I think, you know, for the purpose of this conversation today, we want to talk about normal discharge. And, you know, acknowledging that there is times when you have experienced a change or something does not seem right, and trust that gut and talk to your primary. But today, like, just talking about that discharge is something we do. It is nothing to be ashamed of. It's normalize the conversation about it. But we all go to Target and we walk up and down the aisles, and what do we see?
Bajillion products to make it smell better, to clean.
Because they're capitalizing on the fact that we don't want to smell, right? So, I don't know, the queen of weird. No, that's not nice. No. That's not nice. No. I don't want to say that because I actually really like her. But she's had some pretty provocative things. Gwyneth Paltrow in 2015 was famous because she came out and told everybody she steamed her vagina. And she claimed it was to rebalance female hormones and get the super clean uterus you've always wanted. What do you have to say about that?
I mean, so this is where I run into issues with all of this. So, dear Ms. Paltrow, okay. So
I'll dictate.
If you could, please. Well, here's the issue is I don't know, there's no data to support this in the vaginal steam. I'm even curious, like from an anatomical standpoint, how the steam gets in the vagina that gets to the uterus. Like anatomically, as someone who's done a lot of pelvic exams, I don't really understand how that works.
You got to move things to the side, you know,
right? And now we're like we're putting things like into the vagina. Okay, so let's say
she says mugwort, a combination of mugwort steam and infrared.
No, so that's special. So then, but that's fine. If she wants to steam her vagina, and she's going to get like the very expensive purified vagina steam and stuff, right? My issue becomes like, lots of people want to be like Gwyneth. I want to have like a clean vagina, so I'm going to go on whatever.com and I'm going to order myself a steaming kit. This is the problem. Or someone locally is going to open up a steam clinic for people to improve. I've seen fertility. We're going to improve fertility with our vaginal steaming. We're going to improve menopause symptoms. Like there are promises of everything I see with these steaming clinics. And the regulation, pretty sketchy, right? Like I just think like the burned vulvas, man.
Youch.
Right?
I mean, let's treat it with respect.
It's just like so painful because I'm sure Gwyneth has like all these amazing people are taking. Do you think Gwyneth is gonna watch us? I know, it's so bad.
I feel like she's probably she's kind of been discussed in a lot of different podcasts.
Yes, this isn't the first time. This isn't the first OBGYN who has talked about this.
No.
But we are joining the bandwagon. I feel like it's preying on women. It's inappropriate. It's just so frustrating. First, like, back up for a second. Your smelly vagina, if it's physiologic discharge and that smell, you're the only one smelling it. I can almost guarantee you are the only one smelling that discharge.
Interesting.
I like, if we had you in a room, you're the only one who smells. It's your discharge. You're familiar with it. You know it.
Yes, it's kind of like that thing where your pheromone, I don't know.
Yes,
you know what I mean, right? You can only smell what you're predisposed to smell or whatever. And I think, I don't know, I think we were talking about it and Dr. Richards came in with like the term that she uses, self-cleaning oven.
I was just going to say that because the thing is that you don't need anything to wash or to steam or whatever. And I'll admit, I was 34 years old when Dr. Richards told me it's a self-cleaning oven.
Yeah,
we didn't talk
it's got
about
you.
it growing
No,
up. I'm like, so I had all those products in my shower and was using them.
Summer's Eve. Summer's Eve.
You know what's fascinating about a lot of these products is even there's this one company that like all of their stuff is for external to use on the vulva, but it's weird because the name of their company uses the word vagina maybe in it or part of the word, but like so.
But it's all
external.
And I think they have to say that now because we're catching on, right?
Right. But it's once again preying on women.
Yes.
Like I don't think any woman's like vagina should smell like a creamsicle.
No.
Like an orange creamsicle. Like that was actually marketed, actually unfortunately it was marketed to children,
Really
essentially,
little kids.
teens, about their vagina. So, but that just shows like from when we were small, like this is something that's ingrained in us that like we need to smell a certain way or look a certain way, all those things. But like, leave your vagina alone, please.
Right.
Like your vagina just wants some water.
Yes, nice.
Like
a nice
even not even your vagina, your vulva. Your vagina, just let it be. Like your vagina's all tucked in there, taking care of itself.
Taking care of itself. Right.
People do notice like things that I have done. People have noticed like around their period or like after their period, a change in their discharge. So sometimes we've kind of like manipulated their bleeding that they have with their period or gotten rid of their bleeding to improve the discharge because it has been problematic.
Gotcha.
They're like soaking through
That
with
would
the
be
vaginal
really...
discharge, and it's physiologic, like normal discharge.
Yeah.
It's interesting. Or like other types of vaginal discharge people don't like talking about that's normal is like after a penis goes in your vagina, the sperm.
Yes, it's got to go someplace.
It's got to go somewhere, and like that smell that you might smell the next day or the day after, like that is also normal. Not necessarily pleasant.
No.
But knowing that that's not abnormal. I'll see that every once in a while where someone will say like, oh, it smells so bad.
Oh yeah, also normal. So there's, and I think that you and I have talked about this too before, but like in our conversations with you, Dr. Richards, it's the things that happen to ourselves as women. There's more normal than there is abnormal. Right?
Oh, totally.
And
absolutely.
the things that we have been kind of conditioned to think are wrong, like discharge and smell and these sorts of things. It's like the scale of normal is like this, right?
Absolutely.
And there's so much more that's not.
Do you think it's time to do a shout out for one of our favorite books?
Yeah, let's do it. She's only been front and center, right, for this whole time.
Whoopsies.
Oh, there's all your little
ladies.
Dr. Richards Lego figs.
Different. So this book came out a couple years ago. It's called The Vagina Bible. It's great. It's $10 to $15. It's an amazing book. It's literally 400 pages long. It's a New York Times bestseller written by Dr. Jen Gunter. So Dr. Gunter is just a powerhouse OBGYN who's really just so beautiful.
Well, even read the back. Read the questions on the back. Does eating sugar cause yeast infections? Does pubic hair have a function? Should you have a vulvovaginal care regimen? We were just talking about that.
Right, totally.
Will your vagina shrivel up if you go without sex? What's the truth about the HPV vaccine? So all of these things are covered in this the Vagina Bible.
Awesome.
We should shout out. Not sponsored by the Vagina Bible.
but
We
wouldn't that be
just
great?
love this book.
Yes. And the neat thing is this book is now coming out in multiple languages, and it's great. The vulva and the
Show them
vagina.
again.
Separating the myth from the medicine.
Excellent.
It's huge.
Well, yeah, so again, we could talk for a long time about this and how intertwined it is with, you know, media and marketing preying on women's insecurities and these sorts of things. But another topic, another day,
Absolutely.
another time. Thank you, Britt. Thank you, Dr. Richards. And thank you for joining us for this episode of The Pelvis Party. If you want more information, you can head to rochesterlocal.com. See you next time.
Thanks for tuning in to the Pelvis Party. As we always say, there are no dumb questions, and this is a safe place to ask them. So please drop us a line, let us know what's on your mind for a future episode. And as always, like and follow for more.